Good afternoon and welcome to About Health. I'm David B. Feldman, psychologist, professor, author, blogger, podcaster, and your host. Today, our topic is all about obsessive-compulsive disorder. It's a mental health condition most of us have heard of, but we might not know much about it. OCD. It has shown up in popular movies and TV shows for decades, including What About Bob, As Good as It Gets, Scrubs, and Monk. And yet, you won't be surprised to know that most of these portrayals are not totally accurate. And there are a lot of misconceptions about this important psychological condition. People often think that OCD is the same as being picky, persnickety, or perfectionistic. But as we'll find out today, that's not really true either. For many people, it's an incredibly painful anxiety condition, one that can interfere with their lives in crucial ways, often taking up hours of one's day in compulsive behaviors like hand-washing or double-checking, that, despite many attempts to stop doing, can seem almost impossible to avoid. And it's also a pretty common disorder, with approximately 2.5 million adults in the United States. That's a little less than 1.5% of people living with OCD right now. So today, we'll talk all about OCD, what it is, what it's like to live with the condition, and techniques people can use to treat it. We'll also talk about how OCD isn't a person's fault, and there's no reason to be ashamed if you have it. Joining me by phone is Dr. Kim Rockwell-Evans. Dr. Rockwell-Evans, PhD, is a licensed professional counselor and licensed marriage and family therapist in the Dallas-Fort Worth area. For over 20 years, she has specialized in the treatment of OCD and anxiety disorders, presenting at conferences and providing trainings for mental health professionals throughout the world. In addition, she is the author of the new book, Breaking the Rules of OCD. Find lasting freedom from the unwanted thoughts, rituals, and compulsions that rule your life, which will be the topic of much of our conversation today. Dr. Kim Rockwell-Evans, welcome to About Health.
Thank you. It's such a pleasure to be here.
Well, if it's okay, I'd like to just start at the very beginning. What is OCD? I talked about it a bit in my intro, of course, but what are the main symptoms?
It's characterized by obsessions and compulsions that are distressing and that takes a lot of time. So this can be extremely disruptive to a person's daily life. So an obsession is a repetitive thought, or it could be an image or a sensation in the body that increases anxiety. And so what a person who suffers from OCD is going to do is perform a compulsion, which is a repetitive behavior or a thought to reduce the anxiety that's based on the obsessions. And this can be anything.
Yeah, I mean, it may be an obvious question, but I think it's still worth asking. How can OCD interfere with people's lives? Sometimes just hearing about the symptoms, and you've done a great job of explaining them, doesn't give a full sense of the lived reality. And although OCD can show up in people's lives in lots of ways, both mild and more severe, it can be for many people an extremely hard condition to live with. So can you fill that in for us and maybe give us some examples?
Absolutely. So for an example, there might be a person going to work, let's say, and that person is driving along and they hit a bump in the road. And they start thinking, oh, what if I ran somebody over? And maybe there's some pedestrians on the side, so they circle around. Now this person's on the way to work and they are circling around. They're looking around. They're seeing, is there any dead bodies? Is the police there? And this could go on. For some people, it can get to where it's several hours.
So checking and double checking.
checking and double checking, and then that's usually not enough. And so people may look it up online. They may call the police. So that can happen with somebody that is functioning quite well at work for most of the time or function quite well in their lives. Another thing that can happen with people who are functioning quite well in life is maybe they're at the office and there's a contamination kind of presentation of OCD, that perhaps there's a lot of avoidance of trash cans going into the office building. Punching a elevator button may be very difficult.
Mm.
Actually having, say, coworkers come in to the office and use a pen, for an example. There might be quite a lot of commotion going on to make sure that they're using pens other than the one that they like to use in order to avoid the contamination.
Mm. Right. So again, that thought is, or you called it the obsession, the O in OCD is, what if this pen is contaminated, or what if this button on the elevator is contaminated? And then there are the C in OCD, right? The compulsion, which is the avoidance, or trying to use other pens, or double checking to make sure this isn't a pen someone's used, or something like that. Have I got that basically right?
You have that exactly right.
And, from someone outside who doesn't have a tendency towards OCD or doesn't know anyone with OCD, these symptoms may sound uh, sort of like, well, so what's the big deal? You have a thought and you do some things to try to kind of neutralize that thought. What's the big deal? But it is a big deal, right? This can really, really interfere with people's lives and cause people a lot of anxiety. Can you just talk about how much it can interfere for a moment?
Absolutely. So for some people, it is just unrelenting anxiety that they feel in response to the obsessions. And if they don't perform some kind of compulsion or avoidance behavior, which does give them some kind of relief, it's very short lived, but it does give them some kind of relief, then it's unrelenting and it really can be insatiable. Getting relief is definitely something a person with OCD is going to want to do. And usually they're going to come up with things that actually give them some relief temporarily. And this is what gets that cycle going.
Right. So I think maybe I felt that bump in the road, and oh my gosh, I have that thought that I can't get out of my head. Maybe I ran over someone, and then I go back and check and double check, and that gives me a little bit of relief. But the problem is that when I get that relief, it kind of keeps the cycle going. I have to keep checking in order to feel okay. And that can take hours of people's days. Sometimes, I've heard cases where people did that for an entire day.
That is exactly right. There are people who will do that for the entire day, and then sometimes that doesn't even take care of it. They're checking the internet the next day. They're checking the newspaper. They're checking the news that night and the next day. Often it just continues.
Yeah, so, we've named a couple of examples, and we'll probably talk about lots more examples of things that come up for people with OCD as we go through. Uh, but, OCD is a term that we kind of throw around in our daily lives, and it's often confused with other things. Like, for instance, I've certainly heard people say, I'm a little OCD, right? That's a quote. When what they really might mean is, I'm an organized person, or I'm kind of a perfectionist. So what's the difference here?
The difference is, and we have these fancy words in psychology, that is ego dystonic and egosyntonic. And when something is egosyntonic, it's very much part of who you are, part of your personality. And it's something that people might find pleasing. They like to have their closet nice and organized and color coded, or they like things in its place. Their perfectionism has been rewarding to them. On the other hand, when people are doing things like color coding the closet and they have OCD, the actual disorder, then they have unrelenting anxiety if they don't get it right. And if they don't get it right, it could mean a variety of things. So it could mean that somebody is going to die that day if they don't have it correct, or it could just mean that they cannot leave until it's perfectly looking terrific and color coded according to the rules.
And so that would be ego dystonic.
That would be ego dystonic.
And I think that's such an important thing for people to understand, that, simply being sort of a perfectionist and liking things in order, isn't the same as having OCD. People with OCD often feel a lot of distress and wish that need to have things just so, or to do a particular behavior would go away. I mean, I should disclose that I have a lot of people I'm close to with OCD. And of course, I've worked with a lot of clients as well. And I've really seen how much it can interfere with people's lives. For instance, one person I know has a sort of checking ritual where they're afraid, they have the thought, my house is going to go up in flames. And so they're constantly checking to make sure all the light switches are off to avoid any kind of spark. And that's an incredibly distressing, when they're checking the light switches, that's not fun, right? That's incredibly distressing and alarming to them.
Extremely so, because if you don't do it right, or if you have a doubt afterwards, which is something that as people get in this cycle, then they tend to have even more doubts, then they may leave the house and think, maybe I didn't really get all of the light switches. And they may mentally review, which is an actual compulsion to mentally review in the mind, going through each room and turning off the lights. And then at some point, they still may go back and check again.
Well, let me say, as a psychologist myself, one of the things that I'm always really aware of when we talk about any kind of psychological condition is the incredible amount of stigma, really unfairly, that is often thrown at people who have problems like these. It really always disappoints and upsets me how our society can treat people. Um, and like many other mental health difficulties, there's a big stigma attached to OCD. In fact, in your book, you comment on how people can internalize that stigma and really end up criticizing and attacking themselves. In fact, you use the word shame to describe how people sometimes feel about themselves. Um, if someone's listening right now and they think maybe they have OCD and they're feeling ashamed about it, what would you say to them?
I would say that you are not alone. There are so many people that are right there with you, and help is available. I often say to people, if I had so many of the people I've worked with in the room right now, and you could just see what they're like, they have the same kind of thoughts that you have. And often just knowing that you're not alone, there's a lot of people that have this. When people find out that so many people have these things, that uh, they cry out of relief.
Yeah. Yeah, and people with OCD really are all different kinds of people, right? I mean, there are people who are very functional in their life. There are doctors and lawyers and plumbers and um, uh, really everyone.
Everyone, all walks of life. And even if you have a thought that happens to be about a taboo theme, such as maybe harming somebody, or there's also some themes about sexual sorts of behaviors, then people tend to really label themselves. And this is this is something that again reinforces I better keep this secret. I can't let anybody see that I maybe am actually a killer when it's really just OCD.
And yet, the research shows that people who do have those kinds of thoughts, who legitimately are diagnosed with OCD, they don't act on those thoughts. In fact, one of the reasons that they feel that sense of shame is that they're actually good people, and they don't want to have those thoughts, and they certainly don't want to do anything to harm anyone else. Would I be right to say that?
You would be absolutely right to say that.
So we're going to get into a lot of therapy techniques that you talk about in your book, Breaking the Rules of OCD, in a few minutes. But before we go there, let me just ask, how effective is therapy for OCD? You mentioned that it is and that people can get help. And I guess a corollary to this is, what about medication? Where does that fit in here?
Oh, medication is very effective. One thing about obsessive compulsive disorder is that there's actually research that shows a lot of effectiveness, and and medications that are not just a guess that these medications might work. They work pretty well for probably about 70% of the people.
Hmm.
So they're not going to give every single person relief. In the case of mental disorders, though, 70% is really good. Of course, it's not good enough. We'd like for it to be 100%. And the same thing for psychotherapy. There are decades of research now with very robust findings for exposure and response prevention therapy, and there's metacognitive therapy, other kinds of cognitive therapy that's been researched that have some pretty good results. Exposure and response prevention is the most researched, and acceptance and commitment therapy has equal sort of findings from the literature. So we have some good therapy that people can participate in. And there's a lot of ways of practicing these therapies. So if someone has used, say, exposure and response prevention in a more traditional way, and it didn't get them where they wanted to be, they can try it more from an acceptance and commitment therapy way of doing exposure, and that might get them further. And this is again going to hit about 70% of people who try it are going to do pretty well with it. It's actually a pretty powerful therapy.
And what I always tell people is, if you've tried one thing and it didn't work, and you were in the 30% of people that it didn't work for, try something else, and you might not be in the 30% for that group, right? You might be in the 70%. So, like, if each of these different options has a 70% or so relief rate, success rate, then, keep trying, and you'll probably find one that works.
There is always hope. And also, somebody can, like, let's say you're in the 30% that it didn't give you the effective response you wanted. Maybe a year from now it would. Maybe if combining it with medication, that would help. Maybe seeking out a qualified mental health professional that's trained. And I would say that generally speaking, we do have quite a shortage in therapists who are trained in providing therapy. So if someone did not go to a specialist, then they can seek help from a specialist. And the International OCD Foundation, which is at iocdf.org, is a wonderful resource, and they have all sorts of programs that help educate people. And a lot of these programs are free, and very much available.
Is that also the website people can go to try to locate a therapist in their area that might specialize in OCD? Or do you have any other suggestions if a person is listening and thinking, maybe I have OCD and I'd like to find someone who really specializes in this? How can they go about doing that?
I would say that is the best website to go to, iocdf.org. There are therapists, there's a therapist network, there's also advocates, and they have various programs where they talk about their experience.
So
There are
peer
so
advocates.
many. Yes, yes, there are so many resources on this website, and there's an annual conference that what's wonderful about the conference is everyone goes. We have therapists, we have researchers, we have doctors, we've got family members, kids, people with OCD, siblings of people with OCD. The conference is for everyone, and it's pretty powerful.
Well, perhaps this is a good time to reintroduce you. I'm David B. Feldman, and my guest today on About Health is Dr. Kim Rockwell Evans, psychotherapist and author of the new book, Breaking the Rules of OCD: Finding Lasting Freedom from the Unwanted Thoughts, Rituals, and Compulsions That Rule Your Life. And indeed, we're talking about obsessive compulsive disorder, what it is, what it's not, and how it's treated. Unfortunately, because this is a pre-recorded show, we're not able to take calls today. So, Dr. Rockwell Evans, before I reintroduced you, you were talking about different psychotherapies for OCD. And one of them you mentioned is called exposure and response prevention, or ERP for short, which is also the foundation of your book in many respects.
Yes.
Without getting too technical, can you take a couple minutes to describe what ERP is and how it works?
ERP is a practice of purposely confronting your disturbing thoughts, feelings, and sensations, images, or situations that trigger anxiety. And it has two components. First is the E part, which stands for exposure. And this is the part where you're going to be contacting the stimulus that triggers the OCD. So, like for an example, if you have a fear that a pen or a pencil is contaminated with something, that is now the stimulus that's triggering the OCD. We are going to make contact with that. And that may be depending on how a person is responding and what they're willing to do as part of the exposure, handling that pen. It may be that they're just going to have it next to them because they're not quite ready to actually touch it. Then the second part is the RP, which stands for response prevention or ritual prevention. And this is what a person is going to agree to do so that they're not engaging in a compulsion after they face the trigger. So in other words, if someone has the pen in their hand, they've already agreed in advance that they're going to let that pen be on their hand, and when they put the pen down, they're not going to go and wash their hands or use sanitizer or do other sorts of things to get the perceived contaminant off. They're going to go about their business, touch other things as they move through their day. And then, because this is all about learning, with ERP, the goal of it is to learn something new. And sometimes what you're learning is that these feelings dissipate over time. Sometimes you're learning that what you thought was going to happen as a result of doing the exposure didn't happen at all. So you're wanting to engage in this learning experience, and it's going to be based on helping a person get freedom from the OCD so that they can move on with life and live a meaningful life and have some freedom.
Yeah, I had one client that I did ERP with a few years ago who kind of said it best. We were doing some exposures to some of the thoughts that he was having, and they happened to be about contamination. And he agreed that while he was with me in my office, that he was not going to wash his hands, and we were just going to sit with the anxiety and with the thought that maybe his hands are contaminated. And I asked him before the exposure, how long do you think the anxiety will last? And he said, well, forever. It won't go away. And and it lasted for about 30 minutes. And after about 30 minutes, the anxiety started to come down. And he kind of let out this giggle. I'll never forget the giggle sound. And I said, what are you feeling? And he said, well, wow. So if I just stick with it, this anxiety will reduce on its own. And of course, different people take different amounts of time for it to reduce. But that was a major aha moment for him in exposure and response prevention, that I don't have to do the compulsion, that if I just sit with the anxiety, it will eventually go away. And that was a realization that ended up giving him a lot of freedom in his life.
Absolutely. That gives so much freedom. And also, I would say that one of the things that I've noticed in people with OCD is I seem to remind them quite often that they actually do have agency. They are so beat up by obsessions and feeling like they are forced to do these compulsions that they don't really recognize that they could have a different relationship with whatever the fear is, and they could have an experience where they discover something like this. It's very powerful.
Hmm. Well, as I've mentioned a couple times, your book is called Breaking the Rules of OCD. And you make the case that part of what keeps people trapped in OCD and the pain it can cause, and perhaps gives them that sense that there's nothing they can do to fix it, that they don't have agency to heal, are a set of unspoken rules for how to live your life that many people with OCD have some version of. And part of treatment is learning how to break those rules if and when we have them. We're going to get into all of these rules, or at least many of them, in greater depth in our conversation. But can you just start by giving us a quick bulleted list right now of what those rules are, and maybe say a little bit about how you introduce the idea of these rules to your clients?
Yes. So here's how the rules get there. It's a fact of life that we're all going to be facing discomfort, fears, pain, and potential danger just as part of having normal human experience. So, what our brains do is we do some adaptive things by devising rules. And certainly, our parents, our culture also help with devising rules that help with safety. So things that we learned growing up, like don't touch that hot stove, look both ways before you're crossing the street, and certainly don't try to pet a coiled up rattlesnake. All of these things are adaptive kind of rules that help us, and we are wired to have a better safe than sorry sort of motto, so that we can keep ourselves safe. So rules that might be adaptive in one context are not adaptive in another context, and this is where the people with OCD are going to have some problems. So a person with OCD has a brain that's going to latch onto fears and devise rules to stay safe to a perceived threat. It's really just a false alarm. So the rules, the first rule is pretty much inspired by experience that all of us humans have, and that is that we need to stay in control of our internal experiences. And what I'm talking about there is that We have thoughts, we have feelings, images, sensations, sometimes memories that might intrude into our mind that keep suffering going. And if because we are fighting them and we were following this rule, and it's a very natural one because nobody wants to feel uncomfortable. So the second rule, and actually um, everything except the last rule, are inspired very much by research by a international group of researchers that study OCD and have studied cognitions in OCD. So I have just stated them as rules because people follow them like a rule, such as you must be certain, you need to have 100% certainty in order to feel safe. And
Hmm.
another one is you must pay attention to every single thought you have. Your thoughts are important and they may have power to cause or prevent harm. And then another one, you must be concerned by the presence of anxiety because it's signaling danger. So your experience with anxiety must mean that something bad is imminent. And then another one, you alone are responsible if you fail to prevent harm. And then the next one is everything must be just right. If things aren't in perfect order or you don't feel just right, you will suffer. And then the last one is inspired pretty much by the many clients that I've worked with and watching shame and stigma. And that is, you must keep OCD hidden from others. You are broken and no one will understand you
Hmm.
because this is how people feel. And when people hear things like, oh, I'm so OCD, and they're talking about something like being neat and tidy or a certain personality kind of characteristic, then it pretty much undermines the magnitude of what people who have OCD feel. And so they have a tendency, people will just shut down and isolate and see themselves as broken.
Yeah, I think that these rules are so smart, and hearing them listed out like that, I don't know about other people who are listening, but my mind goes to, oh my gosh, if I had to live with all of those rules, you can imagine how it would make a person anxious, um, and how it would interfere with their lives. So let's dig into a few of these in particular. I think we're probably only going to be able to get to two or three of them today, uh, but let's dig into them. So let's start with, I believe it was the first one you named. You must always control your internal experiences. Why is this not a great rule to have? And how can this rule cause problems in people's lives?
The problem with this rule is that there's a paradox in it, that what we resist persists. And so when you focus your attention on trying to get rid of an internal feeling and you try to problem solve it with normal kind of logic that we use to problem solve other things that go on in life, then what tends to happen is there's this paradoxical effect that your suffering actually gets bigger, not smaller.
Is this the purple elephant phenomenon? Some people listening might have heard me say this before. Like, if I tell you whatever you do, don't think of a purple elephant. Of course, the first thing you think of is a purple elephant, and the more you try not to think of it, the more you think of it. Is that what we're talking about here? That the more you try to control and eliminate your internal experiences, the bigger they become.
Yes, this is exactly what is happening. And this happens when somebody is focusing on, say, a feeling in their body that maybe they think a certain feeling in their body means something. Um, a thought. Certainly, people with OCD that are having disturbing thoughts, they're trying everything they can do to get rid of these thoughts. And then, of course, exactly what you're describing is what happens. And then one of the chapters of the book is called Think of a Pink Elephant.
Mm.
So basically, in this rule, then the solution to this rule is that what you're going to do is you're going to be present and observe your experiences and allow experiences internally rather than resist them. So it is pretty much doing a 180-degree pivot in your mind. So when you are trying to suppress the whole idea of a purple elephant or a pink elephant, then you have to bring into your mind the purple or pink elephant in order to try to suppress it. And it just doesn't work. So what happens is it grows. So if we do a 180-degree pivot in our mind and we say, oh, instead of actually trying to get rid of this, I am going to think it on purpose. I'm just going to allow myself to have purple elephants come to my mind and pink elephants come to my mind. So how this would translate, say, in therapy is a person would when they get a thought, might just allow that thought to be. And as they allow that thought to just be there, and they don't treat it like it's something they need to interpret as being dangerous, they're just allowing the thought to be there, and they're not judging it, and they're just simply noticing it, then thoughts tend to not be so sticky.
So you're talking about mindfulness here, right? We had Dr. Shauna Shapiro on our show a few times, and she's an expert in mindfulness. And one of the points she makes is we all have all kinds of thoughts happen to us. And she was talking about people, whether they or not they have OCD. And sometimes those thoughts are self-critical, sometimes they're critical of others, sometimes they're angry, sometimes they're anxious, sometimes they're depressed. And the more we try to push them away, the stronger they get. So the thing to do is to just allow us to have them and be compassionate towards ourselves. In fact, I think she uses the phrase to herself. She says, "Oh, sweetheart, um, put your hand on your heart or pat yourself on the back and say, it must be really hard to have that thought," and just have empathy and compassion toward it rather than trying, to constantly berate yourself and push it away and eliminate it. Are you talking about that kind of mindfulness and self-compassion here?
That is exactly what I'm talking about, and that is exactly what I'm working with people on, and very much what the book is about as well, is that, and I actually do teach my clients mindfulness strategies because one way they can increase their capacity to be able to deal with the triggering thought that can get them stuck would be to have a regular mindfulness practice. And this can look like many different things. It can be very informal in nature, where maybe while they're at Starbucks waiting for their coffee, they take 60 seconds maybe and just focus on the soles of their feet on the ground and just be curious about, how do the soles of the feet on the ground feel? Does one feel heavier or warmer or cooler? And just stay with whatever shows up. And then you're training that muscle, being present, being observant, and being curious. And curiosity is a much better way at dealing with a fearful thought than treating it literally.
Hmm. Well, another rule that you write about that can keep people sort of trapped in OCD is the presence of any anxiety means I must be in danger. And I have to say, when I read this, it hit me like a ton of bricks. Uh, I've already self-disclosed a little bit that I'm really close to people with OCD, and I definitely tend in that direction myself. Although I'm not sure I would qualify for a diagnosis, it's certainly something I've struggled with at various points. And this thought, if I feel anxious, then I must be in danger, is a big one for me because I feel anxious a lot. And when I'm keyed up and feel my heart racing and my palms sweating, I start to look around for danger. And I've had to learn over the years that just because I feel anxious doesn't mean that there's necessarily always something dangerous to be wary of. You're right that this rule has a lot to do with how we experience anxiety in our bodies. Can you fill that in for us?
So it's interoception. We have interoception, which is how we perceive. It's how the brain perceives our internal experience. And we're talking about things within our skin. So our heart rate, are we hot? Are we cold? Are we clammy? All of these things are interoceptive cues. And all of these cues are things that happen in the presence of a real danger. If you're out in the woods and a bear surprises you and starts to chase you, then you are going to have all sorts of things happening in your body. And so, yes, these are signs that the body may have in an actual danger. So when they happen and they're just happening out of the blue or in response to a thought or something like that, then you do get a false alarm, and it's quite natural that you would be looking around for danger. So some people pretty much are probably born with some higher sensitivity to these interoceptive cues that are associated with anxiety, and we call that anxiety sensitivity. And a lot of people with OCD have anxiety sensitivity. And so what we do is we work on developing a different relationship with sensations in the body. And so there is a type of exposure therapy called interoceptive exposure, where what we're going to do is actually have people practicing bringing on some of these cues by hyperventilation, holding the breath, maybe jumping up and down. There's a whole series of different exercises that we might put together, kind of like a circuit if you were going to the gym and doing a bunch of different exercises. But with this, we are bringing on some sensations that occur in the way of a false alarm. And if you can practice relating to that differently, then it tends to quiet things down in the brain and show your brain that you don't need to be so excited about this. It does take time, so that's why it is a practice that people would do. This is often with obsessive compulsive disorder, not a therapy that's used as much. It's probably underutilized. It's very much utilized a lot with panic disorder. And it's a very effective exposure, and we can combine it with things like thinking a thought on purpose that's a problematic thought that might trigger these cues.
You recommend also for changing our relationship with the sensations in our body, something inspired by yoga that involves moving our bodies and being intentional about our posture. Can you talk a little bit about that as well?
When I started yoga, I started noticing posture. And what really inspired my noticing my own posture a lot is an experience in class where we were doing a pose, which is called Tadasana, and that stands for mountain pose. And when you see people doing this pose, it looks like you're just standing there with really good posture. And so it doesn't look like it would be a demanding pose or anything. My teacher was really giving us some nuanced instructions, and I just noticed how fabulous I felt in this posture because I felt so the my chest was good and open with that good posture, and it was a powerful kind of a feeling. And so I started noticing what happens with my posture during the day and when maybe I might feel distressed about something, what happens to my posture. And of course, I was watching everyone else's posture too. And so, how that translated in the therapy room is I was really noticing my clients and the kind of posture that I could see them engaging in when, say, they had a thought that was a disturbing thought
Hmm.
and how they would kind of fold their posture and into a protective kind of stance, which is one that does not open the chest and make it easy to breathe. So if you already have high anxiety sensitivity, it's not really the best kind of posture to be in that can help you feel like, hey, I don't have to do a compulsion in order to be safe and actually make a choice to do something like just allow that sensation to be there and adjust the posture to a more powerful kind of posture.
Well, I'm David B. Feldman, and my guest on About Health today is Dr. Kim Rockwell Evans, psychotherapist and author of the new book, Breaking the Rules of OCD, find lasting freedom from the unwanted thoughts, rituals, and compulsions that rule your life. And we're talking about obsessive compulsive disorder, what it is, and techniques that can be used to treat it. In particular, we're zooming in on the unspoken rules that Dr. Rockwell Evans says often keep people trapped in OCD. Unfortunately, because this is a pre recorded interview today, we're not able to take calls. So, Dr. Rockwell Evans, I want to get to at least one more of the rules that you write about in your book that can sometimes keep people trapped in obsessive compulsive disorder. And one of them that really stands out to me is you alone are responsible if you fail to prevent harm. You alone are responsible if you fail to prevent harm. At first blush, this doesn't sound that problematic. After all, it's good to take responsibility, but there's no way we can be responsible for preventing all harm. It's impossible, right? Say more here about how this rule can interfere with people's lives.
Oh yes, this can range. This is really there's a broad range of experience that people have when they're following this rule. There are people who um, need to do a ritual in order to be safe, to drive their family, to drive their kids to school. So they may have an elaborate ritual that they do in the car, like maybe with the seatbelt, a repetitious kind of putting the seatbelt on and off, maybe counting, and then maybe saying some sort of prayer in order to keep their family safe before driving the car. And then there's the people who go to the grocery store and they're there to buy groceries and they're there a really long time because anything they see that might fall down and hit somebody or that someone might trip over, they're moving it around. And then there is the person who is very functional, does a really great job. They're responsible at their work, and everybody depends on them because they're so responsible and they feel very pressured to take on more and more duties. And of course, because they're so good and reliable, then they're asked to do more than really what would be healthy for them.
Sure.
And so uh, often this can be a, a guilt sort of a guilt may motivate the person to continue to take on more and more tasks. And so we have to work on like a potential exposure for someone like that is that they're going to say no, and that's very hard, and that they're going to do some kind of act at self care, and that can often really stir up a lot of guilt in someone. So that would just be one way that that might manifest.
This is one rule that I personally wrestle with a lot. And I suspect that a lot of people might, even if they don't necessarily have OCD. I just speaking for myself, I hold myself to super high standards of responsibility and often feel like I have to save everyone. But I've noticed over the years that I hold myself to higher standards than I hold anyone else, including people that I really respect and I see as role models. In fact, you recommend in your book that one way to begin breaking this rule is to actually identify your role models and ask yourself how they live their lives and do they hold themselves responsible? Can you fill that in a little bit?
Sure. So pretty much what we're wanting to do is identify like a double standard that you're living by. You have people in your life that you respect, that you think are you really hold in high regard. They're your role models. You might strive to be very much like them, and you don't hold them to the same kind of responsibility that you hold yourself to. And maybe if they make a mistake, it's okay somehow. But if you were to make that same mistake, then it would not be okay. It would be a disaster. So, uh, part of this kind of exercise would be to identify where are you following a double standard, and how about using those role models that you have as role models um, that that you can actually take on the same level of responsibility that they do, and be more forgiving of yourself for making a mistake, just like you are for other people.
And it sounds like this is another place where self-compassion comes in. You mentioned self-care, that, just to the extent that we can just all be compassionate towards ourselves and say, we're doing the best we can.
That's so important. And that I would say that people are not really very good at being self compassionate. And it takes a lot of practice and a lot of work to do it.
Yeah, it's a skill.
It is a skill. And it's one of those skills that I haven't read any research that shows a downside for humans to practice self-compassion. There's so many positive health benefits.
Well, Dr. Rockwell Evans, we are getting to the end of our interview. We only have a couple of minutes left in the show. And regular listeners will know I often like to end by asking my guests for a big picture message. We've talked about a lot this hour, but if someone's listening right now and they're thinking that they may have obsessive compulsive disorder, what's one message you'd like to leave them with? Maybe something a little encouraging.
You really do have agency. You really can choose behaviors based on what's important to you, not based on what OCD tells you you have to do. You may need help with that, and the good news is that therapy does have some good outcomes. Seek out treatment from a qualified provider that has specialty training in obsessive compulsive disorder. And again, iocdf.org is a good source for finding a therapist.
So there is hope. It's not your fault. There are things you can do. And I think I can speak for myself and Dr. Rockwell Evans to say we are behind you and we're rooting for you. So Dr. Kim Rockwell Evans, thank you so much for spending time with us today. If people want to learn more about you or your work, how should they go about doing that?
I think they could go to my website, which is ocdanxietydallas.com, ocdanxietydallas.com, and there's information there and links to my social media as well.
Well, thank you very much again for joining us on About Health.
It's my pleasure.
And my thanks to all of you, our listeners. You're the reason we do this, and I sincerely hope that this hour has been helpful to you. I'm David B. Feldman. If you'd like to find out more about me, you can visit my website, davidfeldmanphd.com, all one word. If you'd like to hear this episode again or listen to any of our past episodes, you can find them on kpfa.org. Just select About Health under the Programs page. And of course, I hope you'll continue to join us right here each week as we explore important issues impacting your health. From all of us here at About Health, may you be healthy, happy, and wise. Thanks for listening.
The love of liberty is part of the heritage of all men in all lands, everywhere. Of the people, by the people, and for the people. The words of Abraham Lincoln remind us that the opposite of democracy is oppression. The opposite of freedom is restriction and limitations on what some folks can communicate. Another reason why KPFA needs to stay independent and to broadcast without fear or favor. Support us today at kpfa.org.
One of the things I love about my role here at KPFA is I get to hear directly from you, our listeners. My name is Italina, Donor Relations Manager here at the station, and I get to hear things like, thank you for being here for our community. And we get to be here thanks to loyal listeners like you. So help us continue to be here by making a meaningful donation today. And know there is more than one way to donate. You can make a qualified charitable distribution from an IRA, you can donate stocks, you can even add KPFA as a beneficiary. Thank you for being really thoughtful about this. Thank you to our monthly sustainers and to our generous one-time donors. Donate at kpfa.org or email members@kpfa.org if you have a question about donating in other ways, or if you'd like to increase your monthly donation. My name is Italina, here for Community Powered Radio, here for you.
You're listening to 94.1 KPFA Berkeley, 89.3 KPFB Berkeley, and 88.1 KFCF in Fresno, 97.5 K248BR Santa Cruz, 94.3 K232FC in Monterey, and always online at kpfa.org.